Hi, Prof. I am Nieva and I'm here to present our group. I'm with Balchikar Ganate, Francis Gonzalez, and Hatcharan C. For the introduction, the moral standards that regulate one's behavior and decide one's personal and professional conduct are known as ethics. When there is a clash between moral ideas, ethical dilemmas occur. It is critical to observe ethical norms in the healthcare profession since they ensure the integrity and dignity of patient information and healthcare services provided. And we come up for the three following ethical problems discussed in this presentation. First one is the privacy and confidentiality of patient data. Second, end of life issues, right to die. And the third one is the legalization of marijuana across Canada. For the privacy and confidentiality of a patient data. Patient privacy is the most important ethical and legal concern in healthcare. The medical profession maintains strong confidentiality about physician-patient talks as well as an information about the patient's medical status. It is defined what information can be released according to HIPAA, or we call that Health Insurance Portability and Accountability Act. Patients' medical records must be kept confidential by law. Unauthorized sharing of patient information is unethical and illegal on both ethical and legal grounds. For the reasons for the issue, there are inadequate laws and regulations. As a result of lack of a national standard for confidentiality and IPC, disciplinary proceedings are opaque, and there is no idea of patient benefit or societal benefit. Physicians' obligations are unclear. Transparency is lacking in policy, implementation methods, and monitoring procedures. Data release and accessibility are not managed transparently due to a lack of clear regulation. Hospital ethics committees that are ineffectual, a lack of awareness, and data security in cyberspace are all issues that must be addressed. The guidelines to manage the ethical issue in compliance with federal and state laws, maintain confidentiality and privacy of patients' information. Do not discuss patient cases or any patient health-related information in public location. With the help of colleagues in your practitioner or faculty, develop and implement a patient confidentiality policy. All physicians and workers should be trained, understand, and follow privacy policy. And for the last one, consider providing annual confidentiality training to your staff and forcing them to sign a confidentiality agreement once they've completed it. And for the next one, end of life issues, the right to die. When delivering end-of-life care, patients, families, and physicians may encounter a variety of ethical dilemmas, whether determining to remove life support measures, when to utilize supplemental hydration and nourishment near end of life, when and how to deal with issues like truth-telling and transparency, and complicated medical circumstances can arise. Given the inherent intricacy of each patient condition and process of dying, this guide offers a tiny spectrum of possibilities that could happen. For the reasons for the issue, it is uncommon for healthcare providers to have disagreements with the families of the patients they are caring for about medical intervention. And throughout their treatment or hospitalization, certain patients will unavoidably face effects of a mistake. And for the last one, identifying the most pressing ethical issues confronting the public can be a useful and successful strategy to bring them to public consciousness. And for the guidelines to manage the ethical issue. With palliative care, the focus is on optimizing symptomatic relief to alleviate discomfort and improve one's personal life quality. With the latest advancement in Canada Medical Assistant in Dying or MAID movement, it is more crucial than ever for healthcare providers to notice these demands and respond accordingly. Bill C-14, which was passed by Canadian Parliament in June 2016, altered the criminal code to allow physician-assisted euthanasia and physician-assisted suicide, as well as to regulate access to these treatments in Canada, but it is only offered to individuals who are eligible in Canadian healthcare coverage to prevent suicidal tourism. And for the last one is the legalization of marijuana across the Canada. The legalization and regulation of marijuana on the 17th of October 2018 had its fair share of positive and negative reactions raised concerning the Cannabis Act, which aims to prevent youth from easy accessibility to marijuana and to completely displace the illegal cannabis market. For the reasons for the ethereal issue, the framework of the legalization of marijuana across Canada was proposed to address long-standing issues regarding controlling Canada in terms of its sale, possession, production, and distribution in Canada. Implementation of Canada Cannabis Act would have paved the way for the government of Canada to achieve its utmost priority, which is to protect the health and safety of the youth, adults, and concerned population. For the guidelines on managing this ethical issue, individuals 18 years old and above, depending on what province or territory, would only be allowed to possess, use, and share dried cannabis public amounting to 30 grams or its equivalent to non-dried form to fellow adults. Adults are only allowed to purchase cannabis from authorized provincial territorial retailers, whether it's fresh, dried, all-based seeds, or plant for cultivation. Adults of legal age are allowed to grow a total of 4 plants per residence for personal or recreational use, considering that they make use of licensed seedlings. Cannabis goods such as food and drinks are also allowed to manufacture if organic solvents are not used to produce concentrated cannabis products. And for the last one, individuals who plan to grow cannabis for sale are required to license by Health of Canada. Lesson learned from the recent pandemic. Canadian health workers may be forced to make this decision making, while no instances of healthcare personnel being forced to make these types of judgments have been made so far. The spread of COVID-19 virus has created new ethical difficulties for Canadian health professionals and institutions. And policy measures recommended to address the excessive use of marijuana would provide public guidance on the responsible use of cannabis and its consequences, and continuous monitoring on individuals during and after the onset of coronavirus pandemic would be beneficial to fully address this ethical issue. And that's it. These are our references. Thank you.